Massachusetts CNA Nurse Aid Exam Test 2026 40 updated questions and answers. Question 1. Which position is best for a resident having trouble breathing? Prone, supine, Fowler's, Sims. Fowler's, upright aids lung expansion. Question 2. A resident is angry and shouting. You should shout back. Leave the room. Stay calm and listen. Call security immediately. Therapeutic communication involves staying calm. Question 3. Which of these is a sign of skin breakdown? Redness that doesn't go away. Tan skin. Dry skin. Freckles. Non-blanchable erythema is a stage 1 pressure injury sign. Question 4. A resident wants to complain about care. You should tell them to be quiet. Inform the nurse or ombudsman. Ignore them. Tell them they are wrong. Residents have a right to voice grievances. Question 5. A Foley catheter bag should be kept on the floor, above the bladder, below the bladder, on the lap. Below the bladder to prevent backflow/infection. Question 6. Standard precautions should be used for only HIV patients, all patients, only MRSA patients, patients with coughs. Standard precautions apply to all patients regardless of diagnosis. Question 7. A resident refuses a bath. You should force them. Respect their refusal and report it. Call their family. Tell them they smell. Residents have the right to refuse treatment. Question 8. When a resident is on NPO status, they can have water only, ice chips only, nothing by mouth, clear liquids. NPO means nothing by mouth. Question 9. A resident is choking and cannot speak. What should you do? Wait for help. Perform abdominal thrusts. Offer water. Hit their back. Abdominal thrusts, Heimlich, for complete obstruction. Question 10. Which of these is subjective data? Blood pressure, weight, resident's report of pain, pulse. Subjective is what the resident says. Question 11. A resident falls. What is your first action? Help them up. Call for a nurse. Move them to bed. Give them water. The nurse must assess for injury before moving the resident. Question 12. Abduction means moving toward the midline, moving away from the midline, turning a joint, straightening a limb. Abduction is taking away from midline. Question 13. The normal adult pulse rate is 40 to 60 bpm, 60 to 100 bpm, 100 to 120 bpm, 50 to 90 bpm. 60 to 100 bpm is the normal range. Question 14. A resident is in isolation. What is done with their linens? Double bag them. Wash in the sink. Throw them away. Shake them out. Double bagging or special handling per facility policy. Question 15. How often should a resident be repositioned? Every 4 hours. Once a shift. Every 2 hours. Once a day. Standard is every 2 hours to prevent pressure sores. Question 16. How should you identify a resident? Ask their roommate. Check their room number. Check their ID band. Call them by name. ID band is the standard identifier. Question 17. What is a living will? A bank account. Legal document about end-of-life care. A birth certificate. A list of belongings. Advance directive for medical wishes. Question 18. What is the normal oral temperature? 96.6 F, 98.6 F, 100.2 F, 97.0 F. 98.6 F is average. Question 19. What is the best way to prevent the spread of infection? Wearing gloves. Wearing a mask. Hand washing. Using antibiotics. Hand washing is the #1 way to prevent infection spread. Question 20. What is the first step when discovering a fire? Rescue residents. Activate alarm. Contain fire. Extinguish. Race protocol starts with rescue.